So I recently got a question online as to why someone may feel pain or tightness in the posterior knee or the rear knee when performing any sort of split stance activity like a lunge or a split squat. And I thought it would make a nice tutorial as to why this may be occurring and one possible solution that may be of interest. So if we look at the split stance activity, a lot of people will complain of some pain or pressure in this posterior knee, and they'll feel tightness down the front of the thigh here. And you'll see any number of solutions or remedies being proposed, such as foam rolling the quads and stretching the hip flexors and such, saying that the quad is tight. And the reality, I think, is that not that there's some sort of muscular problem. I would offer that this is actually the quadriceps being too active in attempting to do multiple jobs in multiple planes. And the solution is really not in the quads itself, but looking closer as to what's going on here at the hip. And if the hip can't control the position side to side or in rotation, then we have to rely on some other musculature to control this position. And oftentimes the quadriceps can actually try to function in the transverse plane or the rotational plane and in the side to side or the frontal plane here. So I want to give you a couple of exercise solutions that actually may be helpful. So I'm going to talk you through these real quick. So this is going to be a bridging activity, but we're going to also add in some thorax activity to help create some control between the rib cage and the pelvis here. So we're going to learn how to control the rotation of the pelvis. If this pelvis rotates forward, we lose the position of the hip musculature that would control our pelvis from side to side. So we're going to actually teach you how to maintain a posterior rotation of the ilium, which is the bone on the side of the pelvis. And in doing so, we'll maintain the leverages of the stabilizing musculature of the hip that will allow us to perform these split squats without having to rely on the quads doing multiple duties. So what I'm doing here is I'm pushing forward to engage the anterior trunk musculature to bring the rib cage back. So what I'm trying to feel is the upper back into the ground. But what I'm doing is I'm posteriorly rotating the pelvis. I'm going to pause it right here. So I'm rotating the pelvis backwards as I exhale. So that prevents the spine from rounding as I exhale, but I can still posteriorly rotate the pelvis. And so the cue that I would give you is that if you had on your favorite pair of jeans and somebody was pulling down on the back pockets, that's a sensation that you want to create as you're posteriorly rotating the pelvis. We're not trying to round the back per se. And what you're going to feel if you do it right is you're going to feel tension in this upper part of the hamstring and the lower part of the glute. And it shouldn't feel like a crampy sensation. You should just feel some muscle tension there. And then we're just going to drive some breathing. We're going to drive exhales, and as we exhale, we're going to try to push that weight further and further away, which is going to keep this upper back in a nice normal rounded position, pushing into the ground, and then we'll maintain this posterior rotation of the pelvis. So let me go ahead and finish this so you can just kind of see. So there's the breathing, and then there's the reach. And so as I exhale, I am posteriorly rotating the pelvis to maintain position. I'll give you another view. Oftentimes as you do this, you might find that your knees are going to want to try to push apart or separate. And a little remedy for that is just to stick a ball or a foam roller or a yoga block or something in between your knees as you're performing the activity, and that'll keep you from allowing those knees to rotate outwards and actually again lose leverage in the stabilizing musculature of the pelvis and the hip. A second activity that I want to throw at you here is now we're going to move to more of a split stance activity. So this is a supine armbar. And again, I'm going to do a reaching activity to engage the anterior trunk musculature, and I'm going to flex the hip, which will also enhance that. But what you're going to see is I'm going to internally rotate this hip. I'm going to turn this knee inwards and the foot outwards. And what that's going to do is going to actually drive me towards the opposite hip. So even though you're seeing movement here and movement here, I'm actually focusing in on this straight leg. So So what I want to make sure that I'm doing is I'm trying to maintain this toe pointing straight upward towards the ceiling, because as I turn this hip inward, it's going to try to turn my pelvis to the right, which will help engage the stabilizing musculature of this hip. Now, if I let my toes roll out, I sort of lose that position, and I don't gain what I'm intending to gain from this activity. I'll show you from a different angle over here what it looks like. So there's the internal rotation of the hip, or the knee going in, the foot going out. Okay, but what I want you to pay attention to is how hard I'm working to try to keep this toe pointing upward throughout the activity. So as I turn this foot in, I'm trying to keep that toe straight up there. So I'm turning into this hip to keep those muscles on the outside of the hip that would stabilize the hip engaged. Now, this is obviously laying down. We have to transfer this into a standing type of activity. So I'm going to come over here. Now, by putting a band around my pelvis and attaching to something stable as I perform the split squat, I'm actually pulling myself to the left. So I'm forcing myself to engage the outer hip musculature here. And a lot of times, this might be the simplest of solutions to resolve this without even having to do the ground-based activities, because a lot of times by pulling here, I engage that musculature, I take the extra load off the quad, and immediately you notice a resolution of the knee symptoms that you would have in the split squat. So you can actually jump to the chase here and immediately go to this activity if you so choose. Another option is to do an offset split squat. So I've got a load here in the right hand, and what that load's going to do, it's going to cause me to engage my left trunk musculature, which will help stabilize the pelvis and help maintain the leverage of these stabilizing hip muscles. And again, take the extra load off the quad. And again, oftentimes, just by performing the offset activity, I can take the stress off the knee. So there you have it. There's a couple of options and a couple of solutions that you might want to try if you're having knee pain on the back side of the knee during any kind of split stance activity. I encourage you to go to Amazon and download my book. It's inexpensive. It's got a lot of solutions there for you if you've been dealing with some pain and you've resolved it, or you've been to physical therapy and you're not sure how to continue with your exercise program. And if you want to join us over at billhartman.net, please do so.